Me.
Sorry to interrupt. Go ahead, Stephen.
Oh, yeah.
Yeah, I've heard it suggested that one of the reasons why the reported cases have gone down so dramatically in the last 2, 3 or 4 weeks, besides the pandemic itself,
Right.
was the arrival of all the home tests in people's homes.
I've heard some discussion of that. Yeah. Mhm.
And so, is there any idea of what effect that's having, or how much?
I don't think
of an
anybody's
effect?
calculated that yet, but
No.
it's certainly having some sort of an effect. I don't think anybody knows how much. I don't think anybody's actually run the numbers on it yet. But it's a very good question.
There's no requirement for people to report the results of
No.
their own home test, and people with a mild case, get
Right.
it confirmed by a home case, they do what's necessary, but don't actually report it.
Right. That could well be happening. I wouldn't be at all surprised.
Yeah.
So Jennifer, you had something?
Well, yeah. What I've heard is that Pfizer is developing a 4th vaccination for people 65 and older. And I wonder how
That's right.
that's going to play an effect. And I'm like, is there
Yeah.
ever, and I know you don't have an answer, but is
Sure.
there going to be an end to vaccines? I wonder if that's ever talked about.
Well, okay. So Pfizer has made a request to the FDA to get authorization for a 4th vaccine for people 65 and older. Just like you said, Jennifer, that's completely correct, as far as I know. In terms of most other authorities working within the healthcare system, they're saying at this point they're not really seeing a need for it just yet. But they will kind of keep their eyes out and see if it looks like there's something that might be necessary. Keep in mind, their focus has changed from infection to people actually needing hospital care and possibly going into the emergency room. So that's the focus. And that being the case, they're saying at this point, they think that the 2 vaccines with the mRNA vaccine and the booster seems to give enough coverage to keep that from increasing more than they're comfortable with, whatever that number is. Not that they tell any of us. But that's where we're at this point. But believe me, go ahead and keep your ears keep your ears open, Jennifer. You seem to be able to pick up some really good information. But I will absolutely share everything I find out too. But that's kind of where we stand right at the moment. But the reason I brought this up with everything else was we don't really know where things are going right now. I mean, everybody thinks it's getting better, and maybe it is. I mean, it is definitely getting better. We don't really know how long. So I think it's just as wise to try to keep things open as long as we can. The thing is in Whitaker, we have about 74% vaccination rate, which is pretty good. It's Lane County as a whole 72, so we're better than average. But in order to really have community-wide immunity, you really need it more like in the 90% range. So we're pretty low compared to that. But you know, if there's anything we can do to help keep the vaccine clinics open, that's probably a good thing. Yes.
I have to say that it was very peculiar today when I went into the dollar store to go get batteries.
Mm-hmm.
I was the only one with a mask on.
Yeah.
I felt like I was in the Twilight Zone.
Yeah, I've been wearing my mask still too, so I understand. Stephen, yeah.
Yeah, you know, I track the weekly numbers for the zip codes in Eugene and Springfield. And
Oh yeah, that's right.
I've been doing that since the beginning of the pandemic. And last week, the numbers came down yet again. They're way below in our zip code. It was 837 new cases at the end of January.
Right.
Last week, it was down to 29.
That's pretty good.
That's lower than it was at the end of December between Delta and Omicron. But it's still more than double what it was when back in last summer, back in July. So
yeah,
it's not disappeared yet, and still at those kind of low levels where it's bubbling along at the endemic levels, maybe.
Right. Yeah.
And the vaccination rate in our zip code's only been going up 0.1% each week, which is a very, very low increase these days.
Yeah. A lot of people feel that they've done what they needed to do, but
Yeah.
you know, I'm still glad we're doing the clinics. I mean, that 37 or however many people we got was you know, that's respectable.
Yeah.
As long as we keep doing that, I'm happy with it.
Our zip code's at 74.3, but the South Hills 97405, they're up at 87.3. They're
Yes.
like,
Yeah, I saw that.
yeah, like 13, 14 percentage points.
Yeah.
But the numbers were the same for us and for South Eugene.
Oh,
Our
interesting.
zip code and their zip code last week were both 29. It was very interesting that we
It
are
is.
down to their levels now.
That's
Yeah,
interesting.
I think the tests are really a really good asset. We gave away probably about 100 of them at the clinic.
Oh, that's great.
Yeah, we're pretty much through that whole
Oh, wow.
shipment that the board voted to buy that I got
Right.
from Margaret's work. So
Mhm.
we should be getting now another 900 tests.
Oh, wow,
are-
that's
that
great.
I ordered from OHA. And then we're also, with that shipment, we'll also get about 5,000 N95s. And
Excellent.
Ian had the great idea to hold many of them back in case we experience fire season again.
Ah,
So my plan is
Right.
we get those big shipments. I'm going to put them into nice, like usable totes for our
Sure.
businesses. And
Mhm.
then we'll just
Mhm.
pass out the tests and the masks to the businesses. But yeah, one other quick thing I wanted to share too that was
Sure.
interesting today from the OHA was that they had a doctor talking about it sounds like a cartoon, but the Deltacron.
Yes. Yes, I saw that.
It's
I saw that.
they're pretty, concerned about that because the structure of it's so interesting. The spike
Right.
proteins are the Omicron, but it's living on kind of the backbone of the Delta.
Right.
So somehow the two variants fused, but in France they're showing that it's our vaccines are holding steady to both of them.
Right. Right.
That's a
Yeah.
relief.
Yes, I was hearing that too.
It just sounds so crazy. The Deltacron, like it seems like
Deltacron.
Deltacron.
as if things weren't scary enough, right? But
Right.
But then the other interesting news from the OHA today was that they are going to be rolling out on March 31st digital vaccine card systems for our state,
Nice.
which is really neat. Like we'll all get a chance to just have our own QR code.
Right.
We'll have all of our vaccine status within. So that's going to be really nice in terms of if we experience another big wave in the pandemic.
Yeah, Thea, what's up?
Guys. So on the QR codes, hello everyone, good evening.
Hi, Thea.
Hi, Thea.
If someone doesn't have a cell phone, but for example, my husband has no cell phone.
Mhm.
So I keep a lot of the information for him on my cell phone. Are they going to allow a cell phone to have two?
They
QR
sure
codes?
are.
That's a good question.
They
God.
sure are. Yeah.
Oh, they are. Okay, cool.
Yeah.
Great.
They rolled out the test platform for us so we could all see it. And there's
Oh,
this
nice.
awesome little drop down thing. And so like Thea, your husband's card can be assigned to your email. So yeah, there's like family options or folks that are, have disabilities and don't read or can't see right or can't, everything is streamlined so that either your provider or guardian or family member can keep the info.
And then are they going to do a hard copy QR code, which sounds really bizarre, but there's someone like my mother who has no idea how to use her cell phone.
Yep.
And if they're going to start relying on only QR codes, she can carry a hard copy around that someone could scan.
Yep. That's
Kinda
what
like
that's what another option was, that you could sign up through the state and then they'll send you a hard copy so you could keep it in your wallet. So, and it's really awesome that that it has no, information besides just your name and then the vaccines. It's all encoded inside the QR code. So yeah, it's really neat. Kind of efficient new thing they're gonna do.
And did you get a date on when they're gonna roll that out?
Yeah, March 31st.
March 31st. Wow, cool.
Yeah. Come and see.
And how will it be messaged out to let people know?
Sure.
Well, I think they'll probably start with like community-based organizations like ours. So I'll be able to like put it in a letter to you all, and then they'll probably do a big state rollout, or schools
Sure.
will be given the push. So yeah, I think just organization-wise, they'll start that process.
Yeah, there'll have to be instructions on how to do the whole thing and all that. And I'm sure you'll get that and let everybody know. Yeah, Thea.
Speaking of schools, I know I mentioned to Doriandra, and Doriandra's plate is like overflowing, but is getting information to River Road Elementary, Kelly Middle School, North, and Cesar Chavez about our vaccines for our future clinics,
Yes.
because those schools come out of our neighborhood.
Mhm.
Sure. Yeah.
And a lot of those parents are also Spanish speaking. So and a lot of them come from a lot of apartments that don't necessarily watch the news,
Right.
so maybe getting a flyer that can go home, or something in the school newsletter even.
That's a great
Yeah.
idea.
Couple
Would you?
flyers on the doors at school, because they're still not allowing parents into the schools, but if it can go home in the school newsletter or get on the school website, that would be another way to do it.
I
with a
think
link
those
to
are all,
our clinic.
I think those are all great ideas. Something else was there was some discussion about having vaccine clinics going to the schools. Not that I'm saying that ours should do that, but I'm saying that there was some discussion that they were going to do that. I don't know if that actually happened or not, or is going to happen.
Right. It would still be nice to be able to go to some of our neighbors that can't.
Oh yeah, absolutely. Like I said, I think those are all great ideas. As much coverage as possible is probably a good idea.
Thea, do you mind telling me the list again real quick, and I'll write it? I got some of it, but not all of it.
Or sorry, I'm eating dinner.
Oh, it's okay.
It is River Road Elementary,
That's right. I got that.
Kelly Middle School,
What is it called?
Kelly.
Oh, that's right. Yep. Okay.
Put it in the chat if that's easier for you. And then
Oh.
North. And then there's also Corridor and
Right.
Eugene Gakwan, which are right
Okay.
next to North.
Got
Eugene
it.
Gakwan is the Japanese immersion. And then Cesar Chavez is to the south of us.
Right.
Okay.
Okay.
And I think they might also host family school, but you could check with them, or I could check with them.
Did
Okay.
they rename Howard Elementary?
Yeah,
Or,
Howard is now River Road.
Okay, all right.
Yeah.
Jennifer.
Thank you. That's really great.
So that takes me to, how about those that do homeschooling? Are they getting the attention that they need?
Good question. I don't know.
For what kind of attention?
For vaccinations, for any other services that I can't think of right now.
So they access Lane ESD.
I don't know what that is.
Homeschool parents do. And then there's homeschooling through Connections Academy, who's no longer Connections Academy. There's two major homeschools in the state of Oregon, and those schools have their own teachers and they have their own administrators. So, and those kids are from all over the state. They're not necessarily from our area. So Lane ESD would be another option for getting information out, because they would also do the migrant school. There's a migrant school for some of our, and they also have unhoused school. They
Oh,
call
nice.
it homelessness, but they have schooling for unhoused families as well through Lane ESD.
So did you say that there's a migrant school as well?
Yes.
Oh my goodness, I'm just learning so much. And they have means of getting information to them. That's my question.
Yes. So Lane ESD stands for Lane Educational Service District. And Every school district in Lane County has to give them a little bit of money so that they can get needed information to schools.
Hmm. Hmm.
Yeah. I love that idea, Thea. I just put our new flyer in the chat for everyone. It's got the 3 dates coming up. And I'll send out an email tomorrow and get all those, send it to everybody, because that could be easily put in a school flyer. And it's got the QR code for kids right on it. So
Nice.
yeah, that's a great idea. Thank you for that, Thea.
And yeah, thank you. And I know that we don't get to see the chat when you record it, so I'm glad you're going to send an email. That way I can click on it.
Oh.
You can see the chat right now.
I can see it, but when you do recording and you want to rewatch it,
Oh
because
yeah, right.
Oh,
you
right.
don't get the
Sure.
chat.
that's true.
So, Dorandria, do you have anything else to add before we move on to Stephen?
No, I think we covered everything. Yeah, rapid tests, Deltacron. Yeah, we're good.
Someday we will laugh.
Yeah.
So Stephen, you feeling up to explaining what's going on?
Yeah, I'm not a toxicologist, and when I was expecting to get training when I worked at Shell International Petroleum Company, the new recruits had a trainer come from public relations, because the oil industry considered toxicology was a public relations thing, not a toxicology thing. That was a long time ago. Did anybody else go to the meeting, the OHA facilitated meeting on March 1st by Zoom?
Oh.
Are you talking about the advisory panel?
The 5 different agencies that showed up on May 1st for the Zoom call.
On May 1st or March?
March 1st.
Is that with Robert Breck?
It was the one coordinated by Todd Hudson.
Okay, sorry.
No, okay.
Another
There was
one.
a meeting on March 1st coordinated by DOHA, Todd Hudson, and there were several agencies represented at the meeting. There was DEQ, the Department of Environmental Quality. They apparently do soil and water. There was LRAPA, Lane Regional Air Air Protection Agency, is the peer protection or pollution?
I think it's protection.
Protection. And there was, I can't remember the other ones, but OHA, DEQ, LRAPA, EPA.
Right.
I don't remember, there was a 5th one, but I can't remember which one it was. Does everybody know about the J.H. Baxter dioxin situation, or should I just repeat it?
I don't know.
You
I don't
might as
know.
well outline it. Yeah, go ahead.
Okay, there was a very good article which Anand has a copy of in the Register Guard, which was pretty much summarizing the meeting that I went to. That's a very useful article. It was pretty accurate. What the Register Guard mentioned seemed to match my notes of the meeting. Their business was a wood preservative business. They treat the wood so that it takes longer to rot. The people across the road from J.H. Baxter were detecting, there was dioxin levels detected in the soil of properties across the road from Roosevelt Drive. Baxter is like midway between Bertelsen and Seneca on the south side of Roosevelt Drive. And the places that they were testing, that the DEQ was testing, are across the road, across that like canal watercourse that runs along beside Roosevelt. And they found that the concentrations of dioxin in some of the yards across the road were so high that they have prioritized immediate cleanup of 7 of the properties. 3 they're doing right now, and 4 they're doing in a while. There was a lot of discussion about at the meeting about what the different levels of concentration mean for human health. And generally the discussion went around what happens if you eat some dioxin for 26 years, which is a fairly unusual thing to do. And then what happens, how much more seriously are children affected than adults? Body weight is a key factor here. And
Right.
apparently it's fairly difficult to get dioxin into your body. If you breathe it in, it tends to get caught in the mucous membranes of your breathing tubes before it gets to the lungs. And ingesting is much more vulnerable. So if you're eating soil, or if you're a child playing in a backyard, getting food, getting dirt in their mouths, it can cause brain cancer, nasal cancer, lung cancer eventually. What was particularly interesting at the meeting, that the train song contamination, which is some distance away from the J.H. Baxter property,
Right.
had levels of dioxin that were many, many times higher than the levels being detected closer to J.H. Baxter. And what they're trying to figure out now is where the train song contamination came from. They're continuing the cleanup of where they know the dioxin is in the homes and the backyards. And they're trying to establish how widespread that is closer to J.H. Baxter. But it was a big leap and a surprise for them to find levels of parts per trillion that were like 10 times what they were finding closer to J.H. Baxter. Jennifer and I spoke, and we communicated with Ian on this, and we were concerned that potentially the train song contamination could be coming from the rail yards. In Santa Rosa, where I used to live, the area where the rail yards were is a Superfund cleanup site. And dioxin is one of the issues there. Dioxin, according to my conversation with Dylan Whitney from DEQ, he contacted me. I emailed Todd Hudson, the guy who coordinated the meeting on March 1st, asking for who we should contact at DEQ and who we should contact at El Rapa. And the name he gave me and the name of the person who called me today was Dylan Whitney at DEQ. And he gave me a lot of information about dioxin, what kind of chemical it is and how it transmits. And it's fairly difficult to move around. It's not a gas, it's a solid, and it's quite a heavy molecule and doesn't easily move around or bond to dust to get blown around. The other possibility is they're looking at is train song could also be a potentially contaminated site before it became a park. And they're working on that now. Their testing they do is for each site they take 50 samples. And it's fairly expensive for every one at multi-thousands of dollars for the test, the equipment needed, and the process. The other area they're looking at is whether they can do fingerprinting of dioxin to figure out which dioxins are similar to other dioxins in an area. There are 15 subchemicals making up dioxin, and they're experimenting with trying to figure out the percentage of each of the subchemicals in each of the samples they have to see if they can link the train song dioxins to the dioxins that they have from J.H. Baxter to see whether it's similar or the same. He's recommending against us doing our own testing, largely because the cost and it would need to be done with the same protocol as they're using so that the numbers would be at all useful. And it would be helpful once they have more information about train song to know potentially where the train song contamination came from. Presumably, we don't know how it would move from there and how it would have got here. Recently, there was a new, we think it was a new windsock appeared on the building across the road from us in North Polk. And I'm planning to speak with the contact we have at El Rapper, whose name is Travis Knutson, to ask about whether they've put that windsock up to get further information about air movement from the west, from the northwest down to our neighborhood. So they have a better idea of what our relationship might be with the contaminated area. And I think it's a new windsock. It could have been there all along, but we never actually noticed it. But that building also has a business called Cascade Custom Chemicals. They, as I understand it, they take a chemical that somebody wants to manufacture and they give them guidance as to ways that they could manufacture it. So it's a kind of technical kind of place. And I spoke with one of the people that worked there a couple of years ago. He said the only thing that comes out of there is occasional solvents, but nothing else as far as they know, vaporized solvents. But I'd love to know what the windsock is doing there, whether it's connected with work that El Rapper's doing about any possible relationship between this neighborhood and the area between Train Song and J.H. Baxter. So that's where it stands at the moment. I'm still gathering information and have opened conversation with these people who are actually doing the work and have asked them to let us know as they make progress on it.
Sure.
As I say, Travis, Dylan Whitney at DEQ suggested not, I mean, he's obviously not telling us what to do, but he suggested wait until we have more information before you start trying to find money to pay for very expensive testing. And that's kind of where it stands. I'm just kind of going to continue gathering information. And as I get to the point where I think something needs action from the council or from the committee, I'll bring the information back.
Sure. I've got one thing to say and one question to ask. The one thing to say is, we've talked about that plume of contaminated water that's underneath the train yard that's spreading out and it's heading north. It is heading in the direction of Train Song Park. I don't know if it's gotten there yet. So the question is, do they have a current map of where that all is?
Yeah, that would probably be DEQ rather than.
Yeah, El Rapa, that's not what they do. But DEQ would probably be the right people to ask about that.
Yeah, I will contact him next time he's there. Yeah, I imagine
Cool.
dioxin can move in water, even if it's difficult to
Right.
move it in dust.
Right, exactly. So yeah, that's a possibility. I'm sure they're thinking that too. I'm just don't know if they. Go ahead.
Is there any irrigation of parks around here from groundwater, or is there anybody still with domestic wells in this area?
That's a good question. I don't know. I don't think
Yeah.
there's anybody in the immediate area because this was all landfill. So they
Yeah.
wouldn't be putting water wells in that.
Yeah,
But honestly, I don't know. But that's a
Yeah.
good question.
and sometimes parks are irrigated with groundwater.
Right.
I don't know whether they're doing. They're using, according to the signage down at the river park. It says they're using recycled water for irrigation down in the park, so that wouldn't be groundwater.
No, right. Jennifer, what's up?
So thank you, Stephen, for looking into this matter. Yeah, I can't help but wonder, and I'm not pointing fingers or anything, but I've lived here for 21 years in this house, I think for 18 something years. And I never was a smoker or anything like that. And all of a sudden in the last few years, 10 years, let's say, I have lung issues and what do you call it? Pulmonary fibrosis, but I don't know where in the heck that came from. So I can't help but wonder if there's a connection, because you know very well how close I live to the tracks. And
Yeah.
I'm in direct line of fire with those potential toxins. So, darn it, you got my curiosity.
Well, that's certainly a possibility, along with the fires that we've had in the last 4 or 5 years.
Yeah.
That probably wouldn't help things either. And I can think of a couple of other things. Thea, I see a hand.
Yes, so my sister and her husband live on Copping Street on the river, and
right.
they have a well. So we do have wells
Okay.
all along here. Now, most people use them to water their yards. I don't know how many wells are still in the Whitaker area, but I know that there were some. Because we chose not to tap into a well on one of the properties that we sold. Because it can be very, very expensive. Plus it also starts tapping the water table.
Yeah.
And having come from somewhere where I had to haul water, when the well went dry, I was like, we're not going to tap the water table. So
Very wise.
there are wells around here. So
Very good. Thank you.
Mhm.
Good to know. Doriandra.
Yeah, just kind of anecdotally, but that's some scary stuff, Stephen. And I have a vague memory of being in Greenpeace 35 years ago in Eugene, and we were going out to get water samples from the big factories for dioxins. And the running joke was that you wouldn't have to look really far to get the dioxin sample. If you found the two-headed frog, you would know you're in the right place. So I mean, I can just say from 35 years ago, that was a real crisis in our parts of the world here.
Yeah.
It hasn't gone away. Yeah, Stephen.
The very helpful piece of information that came in the meeting on the March 1st was that plants don't take up dioxin. It's not a molecule that plants have in their structure. So if even if we do have it, if we're growing our own produce, we should be washing the produce to wash anything off the surface of the plants. But the plants themselves don't take dioxin up into the structure of the plant itself, unlike some other chemicals that work systemically.
That's good to know.
Encouraging.
And something we should probably get out to the public at some point.
I also recommend plenty of compost and plenty of organic material in the soil is all.
Well, I think
all
that's
very good.
pretty much everything, isn't it?
Yeah, it is.
Okay, I'm gonna pick and over to housing because we just have a few minutes left. And what I wanted to bring up was, okay, the park's closing. The park is closed. People have been moved out. Some have gone to some places. We'll get to you, Jennifer. Some have gone to some places and some have not. And even a bigger problem is the fact that a lot of people don't have enough money to pay their rents. They've got back rents they can't pay. A lot of new people are going to be outdoors. I told people as soon as the CDC said, please don't move them, that as soon as they stop saying that, they're going to have to move people again. And that's exactly what happened. So my thought had been to try to find representatives from all the alternative housing situations in Whitaker, of which there are about 5 or 6, to see if there was something that we could do. If we did it together instead of separately, we might be able to come up with something else. Doriandra came up with information about how the city of Eugene had changed some of their laws about ancillary dwelling units, ADUs. And we might be able to use that as a way to encourage people to get more places, small places built on their property. I was thinking that one of the cooperatives who is used to vetting people might help make that easier for folks. If you were opening it up to people that you didn't know, if you knew some organization that was practiced at it, could find out, how dependable these people were, you wouldn't worry about it quite so much if you were going to let somebody onto your property. I don't know. It looks like East Blair Housing Project. I've been working to get them to come to our meetings for the last half a year, and they don't seem terribly interested. The tiny houses that are down at the end of North Polk are also a cooperative, and I have not as yet tried to contact them, but my hands are kind of up in the air at this point. I know something needs to get done. I don't really know what, but I'm open for any ideas anybody's got at this point. Please. But don't all speak up at once.
I have several things if you want to hear it, but I don't want to.
Yes, I want to hear them. I'll
Okay.
hear anything.
So I just received from Renter Owners Association that the assistance program is being extended again.
Good.
So you have to prove
Do you know how long?
in order to apply for the program for protections, and will begin processing and paying applications submitted in 2022 as early as this week. I'm trying to read. For some reason, my computer's whacking out. Otherwise, I would put the link in the.
That's fine. When you get a chance, could you please send it
It's
to
an
me?
additional week.
Okay.
okay.
Oh boy, that's not long.
They'll keep extending it.
Maybe.
It goes till March 21st, okay, till midnight. So that program's happening. You'll find out more about this at the next portion of the meeting, but I have been with the city talking with them. There are still sites available at our Safe Sleep sites. It's a matter of whether someone wants to go or not. And I know that
Yes.
not everyone's comfortable there. So we've talked about that. I've also talked with the city about doing a mobile resource van like Delaney has been shouting for a long time.
Good.
That looks closer and closer as to a possibility. And I've
Good.
asked them to move at business speed and not city speed. And the mission, we are hosting with the mission on the 30th of this month. We will have the assistant city manager there along with Chief Skinner. I'm hoping Lori Traeger is going to be able to come from the county. We're not sure yet on that one. And then we'll be hosting a second meeting with them to discuss possible housing and possible resources. We're also talking about where do all those people go that we're providing resources in the park,
Right.
because they can't continue to provide them in the park and they can't provide them in front of businesses
Right.
because it creates an issue for our housed and our businesses, which some of them are really suffering right now. Not only because of the pandemic, but because of some of the illegal behaviors that happen. And
Sure.
some of our unhoused are really being preyed on by the illegal behaviors.
Yeah.
And so I really opened some eyes on Friday to the city. And
Good. Thank you.
a couple of them, one of them had not been here in a long time and one had not been here in a very long time. So we're going to, all our people are going to be getting a little bit more love, housed and unhoused. And I think there's going to be a little bit of a better outreach. And I have requested that our resource providers together in a room with some of our business people so that we can work on solutions with our community leaders. So our neighborhood association leaders in the same room to say, how are we going to work on this together? And I think we're going to move that forward as well. And I know Ian has some other things that are happening. So for housing directly, there are spaces.
Jennifer, I'll get to you in just a second. I do have a question.
Mhm.
Do you have anybody who is actually without housing at any of those meetings?
Yeah, well, yes, we would ask
Good.
all of our housing providers right now. Yeah, and I do know that Gabe at Everyone's Village
Mhm.
still has available spots as well. And he's
Okay.
taking anyone in. So
Great, thank you. Okay, Jennifer. I can't hear you, Jennifer.
I'm sorry.
There you
Thea,
go.
yeah, I was in a meeting yesterday where Rennie Kane was there on another matter, and that happened to be brought up sideways, and I did mention our concerns because she's involved with Burrito Brigade of the services continuing on where we're trying to dismantle, I don't know if that's the right word, the WJ Bridge camping, whatever it is. So maybe that'll get the ball rolling, but I did mention it, and she made note of it, clearly made note of it, and understood what the reasoning was. So that's all.
Thank you.
You're welcome.
Doriandra, I think you were wanting to say something a bit ago.
Yeah, I think I was just gonna say that I had that press release today and I was gonna send it in the chat. So let me do that.
Okay.
About the extension, and also,
Oh, good.
you know, it's like how the board was gonna, or Ian talked about being able to hire the housing coordinator person that would
Right.
start all this. And so, you know, the county asked us last week, you know, if basically we'd been able to start, and on that particular side of the council work, and we just haven't because there's just been so much. So we've got to get to that at some point soon.
Yes, that would be nice.
Here, I'll send the press release over today from
Cool.
this.
Thank
So
you.
Anand, that was
Yep.
also sent out today. The Resource Center email came out today because I did complain to the city that the Resource Center Committee
Right.
has not answered emails or sent out an update since August of last year.
That's a long time.
It's a long time. It's a long time to be dissed in our own neighborhood.
Yeah. Yeah, it is.
So miraculously, we got a notice today, and the city is hiring another coordinator. Let me see what that email says. Let's see if I can get it.
For
They are
housing,
hiring. Okay. Sleep site staff has been stretched too thin. Resource. We are currently hiring a new position on the homeless service team, whose primary area of focus will be the Resource Center outreach and system navigation. So they're hiring one more person.
Mhm.
It's like, just get out there and start asking.
Yeah.
I've also discussed the whole vetting process. So
Yeah.
Right.
All righty. Well, I don't think there's much more we can do about any of that, unfortunately, right this moment, which is sad because it's been getting bad and it's going to get worse. And which is weird because, you know, you can see solutions just floating there, ready to be picked if people would just do it. And it isn't happening, and that's sad. And I understand, yes, it'd be nice if people were able to use the spaces, but the other thing is it'd be nice if people actually built some housing. It would also be nice if they did that. And part of the reason they don't is because a lot of people don't want anybody else living next to them. That's kind of all right. I'm done. I've done enough soapbox stuff for one day.
among the other good news is that someone is really starting to work on a real-time bed count.
Nice. That helps
So
a
that
lot.
our resource providers have that. I keep screaming about that, and I think
Sure.
someone's actually starting to work on it. And also